The next muscle in our series is going to be Gracilis, which is another one of the Pizanserine group. We did Sartorius in a previous video or in an upcoming video. Gracilis is related to it in that it attaches at the same part at the insertion, the end of the muscle, the lower part of the muscle, but the upper origin of the muscle is a totally different place than Sartorius. And you can think of these very long, thin muscles that attach to different places. If it all attaches to one place but anchors in different places, each one of those is going to fire to control a different angle of movement of the femur. So Sartorius is all about externally rotating and bending the knee. Gracilis is going to bend the knee, but it's going to internally rotate the leg, right? And so they do opposing things in some ways. They both bend the knee and they both flex the hip, but one externally rotates, one internally rotates. That's really the main difference between the two. So again, just like we talked about in Sartorius, it attaches to the Pizanserine, which in our anatomy books is this little dot right here, medial to the tib tub, but in actuality fascially weaves all the way through the tibia, all the way down to even the middle of the tibia on most people. And again, it's that idea that anchoring to one spot here from a physics standpoint gives you very little leverage over this bone, whereas if it anchors all the way down fascially from here to here, you've got a lot more control over the lower leg in doing that way, right? All right, so origin is the inferior ramus of the pubis, and that comes down straight down the pants seam all the way to the Pizanserine, and again fascially really comes and anchors almost to the middle of the tibia. And so in order to work on it, we can fascially palpate right at the Pizanserine and right at the surface level. I'm not trying to go very deep, I'm trying to skate right across the tissue. We can contact the muscle right through here, right up the pants seam, towards the pubis.